Welcome to Vital Signs. We are here today with amazing guests because we believe in sharing everything that's innovative, leading medicine, ways that we can elevate our health, our human performance, and really become healthier, take control over the asset that which is our health. Why are we here? We are here because of you, and the goal is for you to learn and to maybe implement a little something that you hear today to help bring you forward in your journey towards health. Without further ado, anything that you hear on this show is for education purposes. As such, if you want to begin a new diet or exercise or anything that you hear on this show, make sure that you consult with your medical practitioner or reach out for whomever is providing you care. It's very important that we are not providing medical advice in any way, shape, or form. Without further ado, I'm going to introduce you to our amazing guest, Dr. Rao. Dr. Rao is a wellness and family practice physician. She is the founder of her practice, and she came from an interesting story. So, Dr. Rao, welcome to the studio.
Hi, Jen. How are you doing?
Fantastic. Tell me a little bit about how you moved from what you were doing as a hospitalist into what you're doing today.
I was working as a hospitalist for about 6 years when I started wondering about how my life is going to be 10 years from then, and it didn't look very good. I took a lot of, I took some selfies and I saw that photos, and I looked tired, I had dark circles, I looked aged, I didn't enjoy medicine, and I actually wondered that what was I thinking when I became a physician, like when I went into medical school. And I felt I lost that magic somewhere, and that made me feel really sad about it. And then I started to look at what are the options I have as a family practice physician to come out of the corporate setting, and that's when I explored the options of direct primary care.
And so direct primary care, you were one of the leading edge physicians to really bring that to your area. Tell me a little bit about what's different between direct primary care and what we have come to know over the years.
Direct primary care is basically a contract between the physician and the patient directly, without insurance in between dictating the terms of care between the physician and the patient. So as a direct primary care physician, we do not bill insurance, we do not send invoices or get reimbursed by health insurance, by commercial health insurances and Medicare. So basically the patient pays us a flat monthly subscription fee. All his or her visits and consultations, virtual or in person, after our care is included in the membership without a copay and without any bills from the insurance by the clinic or claims to insurance by the clinic.
And so talk to me a little bit about, as a patient experience, what's different when they walk into your clinic because you're direct care, and I know that there's better quality of life there for you as a physician, there's better concentration on your patient, but talk to me from the patient perspective. If I'm a patient, why would I come to your clinic? What's different?
The difference between an insurance-run primary care and a direct primary care is the volume of patients the physician sees. And in a direct primary care setting, we can choose how many patients we want to carry, and it's usually a much smaller number. And the patient and usually our patients are patient visits is one-on-one. You are the only patient in the room. It's not like there are 10 rooms there and each room has a patient roomed in. The physician goes from room to room. In our practice and most direct primary care practices, a minimum visit time is 30 minutes versus the national average, which is 7 minutes. And we have extended visits, we have availability of same day appointments for our acute visits. So there goes need for urgent care during office hours, and after office hours we still take calls for our own patients, so we know your background, we know your history very well. And also because of this lesser volume for the doctor, I come to know my patients really well, their families well, they come to know me well, and they don't hesitate in contacting me for their health needs, that's the most important thing for me, is for my patients to use my clinic not only in sickness but also for wellness.
And so I really love that, because you're really bringing back the idea of personalized care instead of the actuarian model where we just treat everybody according to a protocol. And so let me ask you, you started with, you were burning out. Like, you described all the symptoms of burnout. I know, I was in sports medicine. I burned out in sports medicine. So you moved because you were burning out. And physician burnout is responsible for over 11% per year physicians retiring early in our country. How did this shift help with the physician burnout, and what transpired in your ability to care for your patients when you made this shift?
What I experienced from the burnout or the symptoms, what I felt was that there was no growth for me personally and professionally in the job I was doing. It became repetitive, and it became to an extent where, you know, I lost my imagination, I lost my motivation for medicine. And because of the hospitalist, the way the hospitalist system works, you don't have a constant communication with the patient. You have new patients every day. After a time, I mean, I loved the experience I gained from the hospital. I learned taking care of different acuities or different levels of sickness with patients in there. But I felt the need for developing stronger relationships with my patients. And I also felt the need, and I also saw the need that a more approachable primary care office is needed, a more approachable primary care system, I would say. I saw patients admitted to the hospital because they could not get their refills on time. They could not see the doctor within a couple of days, just because the doctor had so much volume that their appointments were pushed. And they would not refill their medications without seeing them, which is a very common problem. A problem brought about by the insurance system. It's not the doctor's fault, but it's the system where they operate in works that way.
And we don't go into medicine to follow a system that's pushing people out and not allowing us to actually give best care for our patients. And so what I'm hearing you say is what you were able to do and what you have brought to your family practice is you've brought personalized care where you can be fully present with them and really catch things early, make sure that they stay on a path to wellness. And I know that wellness is a very big passion of yours, and we don't really have time to dive into wellness, but we will do that after the break. But tell me from patient outcomes, how do you feel that patient outcomes improve or longevity or anything to do with our peak human performance, and how does that differ when we have that one-on-one care for 30 minutes and we are comfortable calling the doctor when something's small as opposed to waiting until something gets dire to where we have to go to an ER?
Yes, access is the most important thing, and a common perception of a primary care clinic is this waiting room with 10 people waiting there and a window where you enter your name and the window shuts off. That's my imagination of a because I've seen that, I've gone to such primary care offices. But in a direct primary care office, you have zero wait time. We have the latest technology for the patient to communicate with us. So you can text us. You don't have to leave a voicemail which tells you that we'll get back to you in 24 to 48 hours, right? That's a common message you hear. So we take care of things immediately. And also we want patients and people to imagine primary care as a place where we talk about diseases before it manifests on the numbers in your labs. So we want us to be approachable. We want people to come in with the least effort, no wait time. And that motivates the patient to have a better relationship with the primary care office. Use the clinic more. We're not charging you per visit. You can come to see us 10 times a month to discuss various things. You're most welcome, because it's my job to get you healthy again, get you back on track again, and not wait until the sickness sets in, until a diagnosis sets in.
I think that's so key, and one of the things I'm very passionate is about access, and what we have done is we've kind of cut off access to so many, and what you're doing is you're opening the doors and you're saying, hey, look, we want you to communicate with us. If something's not exactly right, that's a great time to call or text, and you're developing that relationship. And it's given me chills because I feel that community is missing in our healthcare system today, and you're actually bringing community back to our healthcare system.
Yeah, I think it's very important, involving in the community and making people comfortable to approach a physician, not just to be sent home with medication and antibiotics or referrals, but actually to sit down, talk to them, get to know what's going on in their lives, to come to the root cause of what's happening and how we can better their health, and what are the steps we can empower them to take on changing their health.
Fantastic. We do have to break for a commercial, but before we do, can you share with our viewers and our listeners, how can they reach out to you if they would like to learn more about direct practice or about what you are bringing to our world?
Well, you can visit us on Facebook or Instagram or our website at springsmd.com. Phone number is 281-826-1359. You can also text this number, and if you don't want to call us, you can text us for more information. We also do meet and greets in our office, where you can sit down with me and talk about how you feel about your ongoing primary care versus what changes you want to have with selecting your new doctor.
Thank you so much. We will be back after the break with Dr. Rao. She is going to talk to us all about wellness and overcoming burnout after the break, so stick around. We'll see you soon.